Otoplasty is the surgical correction of malpositioned and or malformed ears. That's to say the ears stick out from the skull and or they lack some of the cartilaginous contours that we see along here, causing the ear to look odd and the upper pole to hang like this. I generally correct this issue around the ages of 5 or 6. The child by then is old enough to undergo surgery safely, but also young enough to not have entered school, to not be exposed to bullying and all the meanness that sometimes can happen in schools. There are patients that don't necessarily have both of these issues together. There are patients who have prominent ear, but they already have the contours. In these patients, we make an incision behind the ear, remove some of the cartilage and tack the ear back. Conversely, there are patients who don't have the contours, but their ear is not necessarily sticking out too much. Maybe the upper pole a little bit, and then the flatness in the upper portion of the ear. In these patients, we don't even need to make any incisions. The entire thing can be done with sutures in a completely closed approach. In the subset of patients who have both of the issues on the ears, we perform the incision and also do the suture technique. The entire process takes about 30 minutes per side. Depending on the age of the child, I can perform this under general anesthesia or with local anesthetic with some sedation. In adults, we usually do mild sedation with local anesthetic. The patient is then discharged home with protective covers over the ear. They stay on for about a week. You have resorbable sutures behind the ear. The incision heals very well and it's hidden behind the ear anyway, if we made an incision to begin with, because we can do this, like I said, with sutures alone sometimes as well. Cover is straightforward, it's very comfortable, and at 1 week's point, it's so beautiful to see the reaction on the parents' faces and the patient's face with the new position of their ears. Invariably in my girl patients or those with longer hair, they come back at the 2 months point with their hair tied back, showing off their ears, and it's just a lovely procedure to perform.